Dr. David DeRose is currently a physician at Weimar Institute in California. David is specialized in internal medicine and in preventive medicine. He loves to research. He loves to read the literature. He's had a radio program for a number of years and is known as a very interesting and fascinating speaker. He has a keen interest in health outreach, health ministry, and has been involved in a number of projects over the years in that area. And today he's going to talk to us about lifestyle and healing from prevention to therapy. And we're delighted that he can be here with us. And David, we welcome you this morning.
Thank you so much. Okay. Well, it is good to be with you this morning. It's good to see so many energized faces as we're studying the importance of the message that God has given to us as a people. Well, as we talk about this subject, going from prevention to treatment, I wanted to start with a study that was actually published in Europe. Back in 1990, in the British journal Lancet, Dr. Dean Ornish published research linking lifestyle to heart disease, but not just linking it, actually going from what had been happening in the prevention and epidemiologic arena to the treatment arena. So this famous study, now what? How many years are we talking? Over 20 years ago? Dr. Ornish actually demonstrated that with a lifestyle, very much like we've been speaking about throughout this conference, very much like that lifestyle that God gave us through inspiration, he could actually demonstrate that blockages in coronary arteries could be reversed. It was largely a vegetarian diet. It was a diet that was rich in complex carbohydrates. It was a diet that interestingly excluded caffeine and restricted the use of alcohol. It looked very much like the Seventh-day Adventist lifestyle. At the end of a year, there was remarkable improvements, and I don't want to spend too much time because I know for many of you, you're very familiar with Ornish's research. But here's a slide that graphs some of the remarkable changes that occurred in a single year when those changes were made in lifestyle. You can see blockage in arteries was reversing in these individuals with significant coronary artery disease. Blood pressure was coming down, weight was decreasing, LDL cholesterol and total cholesterol were falling, and we did not see those remarkable results in the control group. In fact, when you look at that second category there, angina frequency, that's divided by 10, you can see that the control group was having increased frequency in their chest pain, while those on the lifestyle regimen were having a decrease in their chest pain. Well, Ornish continued his follow-up, and this is some data published in 1998 in the Journal of the American Medical Association, showing the persistence of the benefits with this type of lifestyle approach. This graph is probably the most telling, because what it illustrates in the blue is the group that is getting treatment. This is looking at the blockage in their arteries, the percent of the diameter of the heart arteries, the coronary arteries that were blocked, and you can see at 1 year, that's the second set of bars, and then at 5 years, there's a progressive decrease in the blockage in the coronary arteries. Whereas in the control group, getting a standard approach to coronary artery disease treatment, you can see that their blockages progressively became worse. Impressive data, but that data, that treatment data, did not come just out of the blue. Ornish basically was implementing what had been happening in the epidemiologic realm, what studies had been showing and what interventional studies had been showing into the 1980s. In America, I can remember early in my medical career talking with individuals, fellow physicians. We were still reporting cholesterol levels. Even today, Americans have these strange units that we use. We have not gravitated to the SI system, and so giving you a bunch of numbers would be probably less than helpful for you. But here's the point. We were considering very high levels of cholesterol, that we would consider very high today, to be normal in the 1980s. And in the 1980s, there were more and more studies coming out, both observational and experimental studies, that showed if we lowered cholesterol, we could actually prevent heart attacks. Now, for many of us, we would yawn today, but back in the 80s, this was dramatic work, and we were further making that linkage between cholesterol and lifestyle and heart disease. And so what Ornish was doing, he was really going from prevention to treatment. He was going from epidemiology. He was going from risk factor intervention, for example, with cholesterol, and saying, let's see if we can do the same thing with lifestyle. And the results were impressive. Now, there's an important footnote to all of this, because one of the undercurrents in all that we're talking about in this conference is how do these things impact us as individuals? We're not just talking about disease. Yesterday, the stage was set for us talking about optimal health, talking about freedom from condemnation, freedom from subjugating people with a health message that is restrictive and not freeing. And so it's interesting that when we look at what Ornish initially reported in the journal Lancet, he was already aware that many people were going to accuse those who were following healthier lifestyles of taking the joy out of living, of somehow making us a little bit more miserable. And what Ornish actually demonstrated, instead of the people who followed the lifestyle, the rigid lifestyle program, having a lower quality of life, having less happiness, more anhedonia, lack of pleasure in living, there actually was an improvement in those measurements in those who were on the strict lifestyle program. Now, some of you might say, well, that isn't surprising because they were getting better. So they were willing to put up with some major inconveniences. But I'd like to suggest to you that there may be more to that question, and hopefully we'll touch on it as we continue. After Ornish published his research, there was a flurry of activity, a number of individuals coming to center stage, including very prominent researchers like Dr. William Roberts. Dr. Roberts has published some 1,500 publications. Most of those are peer-reviewed publications, a prolific author, editor. And Roberts, within 5 years of Ornish's paper coming out, was taking some very bold stands in some of the cardiology literature. At the time, he was editing this particular journal, and he was making assessments like this. Human beings clearly have more characteristics of herbivores than carnivores. This is interesting in an American medical journal. And then he says this: foods intended for Homo sapiens probably are only 3: starches, vegetables, and fruits. Now, many of us in this audience, myself included, would say he's probably taken this a little bit too far. The Seventh-day Adventists, and I'm assuming Dr. Fraser will speak some about this, have made a unique contribution to the cardiovascular literature in a number of ways. But one of the monumental ways, from my perspective, as a practitioner of preventive lifestyle medicine, is with the awareness of the benefits of nuts in the diet. And I don't know if Dr. Fraser will be speaking on that some in his next presentation, but there's some amazing things that Dr. Roberts was, I think, missing, and granted, this was some years ago. But the point is, Roberts was arguing in this paper really for Americans and for every person to think seriously about a vegetarian diet, and he was even using, amazingly, arguments from design. And he's not someone who has gone on record as someone believing in a divine creator, to my knowledge. Well, let's look a little bit more then at some of these chronic diseases and risk factors and see this continuum, how it's been playing out between research, between prevention, and then coming to treatment. Let's talk a little bit about diabetes. Dr. Fraser shared with us yesterday in his workshop what I think is some really remarkable data from the Adventist Health Study, and no doubt we'll be hearing more about this during the conference. This is, to me, as you look at this epidemiologic data, incredibly impressive, because you see some remarkable differences when you categorize the Adventist population by their habitual dietary practices. Now, yesterday, rightly so, we talked about some other things that may confound these relationships. It may not be purely diet that we're looking at. So I want you to keep this in mind. But I'll tell you, as a practitioner, let me illustrate something on this slide. You look at that first bar to the right. You look at the reference group. That's the risk of 1 for diabetes and hypertension. They are the non-vegetarian Seventh-day Adventists. But then you move just one bar to the right, and we see the semi-vegetarians. So these are individuals who, if they walked into my office and I said, what is your diet like? They would say, Dr. DeRose, I'm basically a vegetarian. These are people that are eating few servings of meat, fish, and things of this nature, and you see they get benefit in both the likelihood of developing diabetes and hypertension, but it's nowhere near as profound as those who are following a more restricted diet? Is that the way to say it? Or would it be perhaps a more liberal diet when you actually look at the variety as you go further down to the right? Most people, as you go further to the right of that continuum, often eat a more varied diet. Well, that's epidemiology, but there's been research before. This data was published just a few years ago that was showing similar relationships. And so you have people like James Anderson and Neil Barnard and others that were publishing Jenkins, that were looking both at the literature and then at interventional studies that were basically showing that the same kind of diet that the epidemiology shows is correlated or associated with less likelihood of developing disease like diabetes. If you implement it, if you apply that diet in a controlled setting, you can actually help to regress or reverse or ameliorate, or whatever words you want to use, you can help the diabetes. And so we're looking at what happens. We look at free-living people. We see how their lifestyles are associated with a decreased risk of disease. We put those into practice in a lifestyle context, and we see often the same benefits are reaped with these major chronic diseases. We have seen this at Weimar as well, and we've published this data showing similar benefits in a residential lifestyle change program. This, published in the journal Diabetes Educator, looks at a series of some 300 to 400 of our patients who've gone through the Weimar New Start program. And I know some of you aren't familiar with our program, but we're a small Seventh-day Adventist lifestyle center in Northern California. We've been there for over 30 years, and we're trying to implement this kind of program that God has endorsed and that medical science is validating. And what you see here, whether you're looking at lipids, whether you're looking at blood sugar, whether you're looking at weight, remarkable things happen, and most of these measurements are between 2 weeks and 18 days apart. Well, let's talk a little bit about the other graphic on here, and that's the high blood pressure graphic. They look very similar, but high blood pressure is another one of those conditions that the epidemiology suggests that lifestyle factors have a profound influence on the development or the presence of high blood pressure. They also are showing us now that treatment based on these lifestyle approaches can make a profound difference. It's not just simply, though, this continuum with animal product consumption that's involved, but sodium does continue to emerge as a powerful risk factor for both the development of high blood pressure, and it's also something that we can use as a treatment approach to hypertension. This carefully done study in the New England Journal of Medicine actually looked at the epidemiologic data in America and what would happen if Americans merely decreased their sodium consumption by a half a teaspoon, about 1,200 milligrams of sodium a day. The results would be profound, saving hundreds of thousands of years of life and saving billions of dollars in costs from something as simple as decreasing salt consumption. Now, by the way, as we talk about these things, some of you are already making this equation in your mind. We're somehow talking about an unpalatable or undesirable lifestyle. After all, salt is what brings savor to our meals. We're not talking about a salt-free diet. We're talking about a diet that modestly decreases sodium. It has profound benefits. So again, what we see has happened over the last number of decades. We see a spectrum going from epidemiologic research, observational research, to actually treatment research, and to extrapolations from both the epidemiology and the clinical trials telling us that we can reap profound benefits as a world, as a society, if we change our lifestyle. Well, here's part of the best news I can give you in this conference, and it's news that many of my patients have not yet fully recognized. And that is, we're not talking about making our lives more miserable in order to live longer. We're actually talking about high-quality living where we can reap the benefits of an optimal lifestyle and we can enjoy our life. Because the way God has designed us is with the capacity to develop new enjoyments. It's been shown classically in the sodium research literature. This is a study, an old study in the American Journal of Clinical Nutrition, that actually looked at what happens to salt preference when you get on a salt-restricted diet. If you decrease your salt consumption today, your food will not taste very good initially. But if you stick with that, and in the data, it takes about 3 months to fully develop a taste for lower salt foods. But you can see in this graphic that there's a progressively increasing preference for less salty foods as you follow a low sodium diet. We could talk about that on a number of levels. I could talk with you about it personally, because like many of you in European society, I grew up eating the sausages and the cheese and the meats and the other rich foods. Actually, it wasn't necessarily my parents that gave me all these things. When I got on my own, I wanted to experience all these wonderful foods that the world valued. I was not raised a Seventh-day Adventist. We didn't know vegetarians growing up. So I'm just letting you know, whether I look at my own personal lifestyle, whether I look at my patients' lifestyles, whether I look at the research literature, we're not talking about trading a happy life for a miserable existence that helps you live a few years longer. We're actually talking about something that can improve both the quantity as well as the quality of your life. To me, this is extremely encouraging news. And we see this data in studies that we've already talked about. Just like Ornish's data showed an improvement in quality in those in his intervention, you find if you look at his data on high blood pressure in those subjects, this is actually a much larger series. This is after Ornish's program is now being disseminated throughout a number of centers in America. And you see, over the course of 12 weeks and then a year, although some of the results are not maintained for a full year, you see there is actually by the way, these are all statistically significant differences at the less than 0.005 level. So statistically significant changes in blood pressure, systolic and diastolic, both in over 1,300 individuals going through now, which is somewhat of a franchised program throughout the United States. Again, showing the power of lifestyle change, a power of lifestyle change in the context of something that can increase quality of life. Well, one of the big questions, and I know we'll spend some serious time looking at this tomorrow and onward in the conference, perhaps even later today, is the subject of cancer. What about cancer? It seems like these chronic lifestyle diseases, diabetes, hypertension, coronary artery disease, yes, some of the same things that help prevent the disease can be used to treat it, but is that true about cancer? It has seemed to most of us that cancer was different. But actually, the science continues to grow. Many of the leading authorities in the world collaborated on this second expert report that came out now about 6 years ago. The American Institute for Cancer Research and the World Cancer Research Fund published this second expert report reviewing lifestyle factors, in particular that have a role in the development of cancer. And you see recommendations coming out of groups like this. These are very familiar, very similar to the things that we saw with the chronic lifestyle diseases of diabetes, hypertension, and coronary artery disease. And it's telling us to trim down. It's telling us to be physically active every day. Isn't that interesting? I can remember as a young practitioner, we used to, at least the common wisdom was to tell people to exercise 3 or 4 days a week. But do you know, most people don't develop a habit that they do 3 or 4 days a week. Think about this very closely. We're not just talking about choices. We're not just talking about biological variables that come into your body. We're talking about lifestyle. And this is one of the things we often miss in the dialogue. So physical activity every day, avoiding sugary drinks and other energy-dense foods, eating more plant foods, limiting consumption of red meats, limiting alcohol intake, salty food, decreasing that. Don't use supplements to protect against cancer. A number of interesting studies have shown increased cancer risk in individuals taking supplements to try to avoid it. Beta-carotene is one of the classic ones that have been demonstrated to increase lung cancer among smokers. That's a whole story that maybe we'll fathom later in the conference if that's of interest to people. And then you can see a couple of other recommendations there. Well, let's talk about a few of the things in prevention. Now, this is so obvious, you say, why even put it up here? How preventable is lung cancer? This is from the report I just showed you. 90 to 95% preventable by a single lifestyle factor, and that is not smoking. Yesterday, Dr. Fraser was speaking to us about getting more engaged with the political process, and it seems like the Lord is nudging us to do this, at least in my own realm. Just last week, one of the things that was preoccupying my attention was this project from the Centers for Disease Control. This is our big preventive medicine group, if you will, in the United States, federally funded group, and I'm speaking somewhat using interesting terminology to try to make this practical. It's a government agency, the Centers for Disease Control and Prevention. They're right now doing their second year of a program designed to help Americans stop smoking. They're especially concerned about a certain demographic group in America. They are Native Americans, the American Indians. The radio show that Dr. Harding referred to, that I've been hosting for about a dozen years, is actually called American Indian Living. I host a weekly health radio show. Goes out on about 100 stations through a variety of networks, especially targeting Native Americans. What's so interesting to me is over the last year, the Centers for Disease Control reached out to us. And they're now doing a campaign with us on American Indian Living to try to decrease tobacco consumption among Native Americans. Dr. McAfee was my guest as we recorded a couple of programs last week on this campaign that the Centers for Disease Control is doing. I didn't know the background for it. I was wondering about why they were working with us, but I later learned from some Native Americans that the government, the American government, was having trouble getting the word out to Indian tribes. They would publish things and the Native Americans would not read their materials. This is the story I heard. And so they asked some tribal leaders, how can we get Native Americans to listen to our messages about health? And they said, you have to go to the Seventh-day Adventists. So whether that's a true story or not, that's what was relayed to me, and I can tell you for a certainty that the Centers for Disease Control is working with us, and we are airing these programs and a series of public service announcements. I'm not saying this is a substitute for what Dr. Fraser mentioned yesterday, but as we continue to hold up the banner of preventive medicine, it is being recognized. Whether it's through the Adventist Health Study, whether it's through things you're doing in your community, whether it's through the health clubs here in the Czech and Slovak republics, these things are being noticed by people, and yet there are opportunities for us to do more. I want to mention to you something about cancer that I think is especially important in light of developments in the Seventh-day Adventist Church. If you look at a number of cancers in expert opinion, they're telling us, and you can't read the fine print, but that we should avoid alcohol consumption. I hope many of you realize that here in Europe you have done some incredible work in the field of epidemiology when it comes to cancer. The European Perspective investigation into cancer and nutrition is really yielding some tremendous research on this subject. Of particular interest to us as Seventh-day Adventists, as our church members are moving away, I would say, many of them, from a perspective that is divinely guided. They think they're somehow moving further ahead if they're listening only to expert scientific opinion, because it doesn't matter if we deviate just a little bit from the counsel God has given us. I would like to tell you this is a dangerous position to take, and I will illustrate it with the subject of alcohol. Many Seventh-day Adventists in America, no doubt here in Europe, are engaging in moderate drinking. Sadly, many of them are using health justification to do that. EPIC here in Europe has shown us that this is faulty logic, faulty reasoning. Because what we're finding about alcohol is the data is compelling. There is no safe level of alcohol consumption when it comes to cancer. Basically, as it was put here, in the report in the British Medical Journal and subsequent press that was given to it, the cancer risk increases with what? Every single drink. So even moderate amounts of alcohol, as little as a small drink each day, increases the risk of these cancers. The Oxford Vegetarian Study gives us the flip side of this data. And this group is, of course, working with EPIC, but their data antedates it. The Oxford Vegetarian Study showed us another important connection with alcohol, and that is if you're on a phytochemically rich diet. Presumably this is the reason that you get no benefits for your heart from even moderate alcohol consumption. And this was published back in 1997 in the journal Heart by researchers here in Europe. The point to me seems to be simple as we look at this continuum from prevention to treatment, because now in the cancer literature, we're coming up with studies like we should be going to the same kind of diet and exercise recommendations in people that have cancer in order to treat cancer, especially early cancers. This particular report looked at this, and none other than Dean Ornish has been showing the same thing, now using an exclusively vegan diet to try to treat early-stage prostate cancer, and showing in a number of papers that you can decrease PSA levels, you can turn off those genes that we heard about in the previous lecture by lifestyle. And telomerase, this compound that helps protect genes, this is increased, the activity of this compound, when we get an optimal lifestyle. The message as we conclude to me is simple. God has actually given us a program we do not need to be ashamed of. From the standpoint of prevention, from epidemiology, this program is powerful. From the standpoint of treatment, it is powerful. And the data calls us to pay attention to the minutia, because the minutia is what's involved in developing habits that we maintain for the rest of our lives. Let us close with a brief prayer together. Father in heaven, we thank you that as we've talked about science and as we've been studying your principles, we see a divine harmony. Please help us to continue to catch that perspective as we study and as we fellowship together. In Jesus' name, amen.